Can I come in? Thank you. Good morning, Mrs. Johnson. How are you doing today? Good? All right. My name's Michaela. I'm going to be your nurse today. The reason that I'm here is the IV. Joey, he needs an IV today placed in his arm. This is just to give his medications, okay? This procedure is just going to be like any other procedure that involves a needle. There's going to involve pain, maybe a little bit burning, and you know, this is pretty normal. I'm sure you've gotten shots before, right? So you should expect him to cry a little bit. Please don't hesitate to stop and ask me if you have any questions at all during this procedure. All right, so the first thing that I want to do is just make sure that I have the correct patient, okay? Can you please verify Joey's birthday, his birthday and his full name? Thank you, and I'll just go ahead and verify the information against the wristband as well. All right, great. So the first thing I'm gonna do is perform hand hygiene. I'm gonna go ahead and glove up. I'm going to go ahead and gather my supplies, and I have everything right here. As you can see, I have the IV kit, the pre-filled saline syringe, needle, pretty much everything that I need. The needle that I chose today for this patient was the 22 gauge 1-inch needle. The reason I selected this needle is because he is a pediatric patient. He's 1 year old, so I felt that this was the best needle for him. Maybe if the patient was like geriatric, or they just had like really small veins, whatever the case is, I would use a 20 gauge needle. If they were just like an average adult patient, or they needed fluids or blood products, I would use a 18 gauge needle. All right. So the next thing I'm gonna do is get my 12-inch extension line ready. Go ahead and do that. Connect these together. Loosen that up, and I'm just gonna go ahead and prime the line. This is just to make sure there's no bubbles in the line. All right. Put that back up. I'm just gonna go ahead and look at it and make sure it looks good to me. All right, great. So the next thing I'm gonna do is I'm going to look at the patients. On children, on pediatric patients, you can also go with the foot. But for this patient, since he's a baby, a toddler baby, I'm gonna go ahead and select the antecubital space on the arm instead of one in the hand, because they move around too much. So I'm going to go ahead and place my tourniquet on the patient. This is gonna be about 4 to 6 inches above the site that I intend to use. I'm gonna go ahead and check for a distal pulse. So on this patient, I would be checking his radial pulse. All right, I'm gonna go ahead and just palpate the vein a little bit. I'm just making sure that it's nice and juicy and plump, especially with dealing with these needles. I have the iodine, but the patient has a shellfish allergy, so I'm gonna go ahead and use the alcohol swab. And I'm gonna clean the site with this alcohol pad in concentric circles, starting at the middle of the site where I'm going to stick the patient. And I'm gonna let that dry. I'm gonna go ahead and get my needle ready. And I'm going into this patient's arm with the bevel up. The angle is not gonna be like too low or too high. I'm gonna anchor about 2 inches below the intended site. And when I go in, I'm looking for a flashback of blood. All right, I got my flash. So now I'm gonna continue to insert this about another 1/4 of an inch gently and loosen the catheter and push that out. Put this in my sharps. I'm making sure that I'm still anchoring this site with my non-dominant hand, because I don't want the blood to come out of the needle and get over the patient. I'm gonna go ahead and release my tourniquet. All right. So the next thing I'm gonna do is just go ahead and apply the tubing with my dominant hand, making sure that I don't touch inside anywhere. Alright, get that on nice and tight. And now that that's in, I'm gonna go ahead and aspirate just a little bit. See, make sure I have some blood coming out. Alright, and then I'm going to go ahead and prime. As you can see, there's some liquid coming out because this banana is not really taking the priming very well, but I would prime all the same, you know. And then I'm gonna go ahead, lock this down, remove this. I'm gonna go ahead and place my sterile gauze over the site like that. Remove this part. Alright, I'm gonna go ahead and secure it with some tape. And then I'm gonna secure the tubing as well on the patient. I'm going to go ahead and I'm gonna put the date, the time, my initials, the needle gauge, and the length on the patient. I'm gonna go ahead and get rid of all these supplies that I have used. Alright, I'm gonna go ahead and remove my gloves. And then I'm going to go ahead, throw these away, perform hand hygiene. All right, Mrs. Johnson, I'm all done with Joey's IV. Please don't hesitate to let anyone know if he's like reaching for his arm or if you sense any type of discomfort or pain with him, okay? All right, thank you. All right, can I come in? Hi, Mrs. Johnson. I'm just here because Joey is going to be discharged soon. He's all done with his IV, so we're going to go ahead and get that done for him, okay, before you guys leave. So I'm going to go ahead and please tell me Joey's full name and date of birth. All right, let me check the wristband. All right, perform hand hygiene. Put my gloves on. Grab the supplies that I'm gonna need. All right. So with this, I'm gonna go ahead and just get the tape off the dressing, the patient, while making sure that I'm being really careful because I would not want to pull the needle out prematurely. Just making sure that I have the needle, holding the needle correctly. So I'm gonna go ahead and place a sterile gauze over the site, and I'm gonna gently, slowly remove the needle. Just looking at the integrity of the needle, making sure nothing's broken, the length still looks the same. you know, it looks good for a needle that came out, because if we lose a tip in there, that can cause a lot of issue. I'm gonna go ahead and put this in the sharps. I'm gonna hold this for 30 seconds because I want to make sure that the bleeding stops. I'm gonna go ahead and check. All right. I'm gonna go ahead and tape the patient up. Alright. That's all done. I'm gonna go ahead and remove my gloves. Perform hand hygiene. And I'm all done.